If you knew me before, you wouldn't even look my way. If I had the nerve to speak, you wouldn't hear what I say. Time has come and gone so fast, we're not who we used to be.
Yeah. And welcome back to Sullivan's Unheard Voices. I know it's just me again, but I finally got a chance to come back to our studio here in Kaiser at the Rec Bowling Alley. It's been about a month, and I wanted to come up here and talk about some of the things that have been going on the last couple of months, because rarely do I get an opportunity to talk about the realities of my life and how it sort of dictates, I don't know if dictates the right answer, but it sort of pushes forward how I approach this podcast. And one of the things that I have learned over the last few months is just how messed up our current healthcare system is. And I say this with the knowledge that I am in a very privileged position. And what I mean by privileged position is that I have the VA to help offset the costs of private insurance. Now, for the longest time, I would use my employer-based healthcare as the primary driver of getting my health needs met. But what has happened over the last couple of years specifically, and this has started when I had a very serious rollover accident involving a riding lawnmower. And in essence, is I had no business using a riding lawnmower on a hill so steep. At the same time, the feeling of guilt and the feeling of inadequacy because I couldn't physically mow my own lawn caused me to go out and buy a lawnmower. Now, I'm not going to get into a lot of the underlying story that gets into that. Just know that inevitably the riding lawnmower ended up rolling over on me 3 times. The first 2 times happened the same fall, but then, as somebody with a TBI at that moment, I didn't have the wherewithal to stop because I just had a major concussion. And so I tried again, and it rolled over on me again. Now, it cracked 6 teeth, it messed up my ankle, it messed up a few other spots in my body, it caused a couple of hernias, and it took me a really long time to get treatment. As a matter of fact, to this day, there are parts of my body that have never been treated as a result of that rollover accident. Now, there are 2 reasons for that. The first is because the relationship that I was in at the time was concerned about how much it was going to cost us as opposed to seeking immediate attention. So I went a number of hours/days before I went to the emergency room. And then when I went to the emergency room, they didn't really do anything to help because they said the urgent is past now. And so, yeah, we're just going to have to kind of wait and see, right? And so here I am in an extreme amount of pain with a TBI, not really able to function. I don't really have a primary care because of the way the insurance was. That's a long story in of itself. So I didn't have a primary care provider. The emergency room wasn't listening to me, but I also had a TBI. So and I also was on overstimulation mode. So all of these things sort of roundabout, right? And I asked for accommodations. I asked for additional help. None was ever provided. In fact, Providence told me at a couple of points, they don't provide accommodations. So here I am in desperate need of medical treatment and a medical establishment that refuses to help the situation. I go to the emergency room at the VA. I'm not able to articulate everything that's going on, so they release me without doing a single X-ray, without doing a single CT scan, without doing anything other than, well, you seem to be able to walk okay, so you must be fine. And so here I am stuck in this sort of medical limbo, not having a primary care I go to, not having access to a neurologist. As a matter of fact, I've never seen a neurologist, even though I had a significant head injury and Lord knows what happened upstairs. and all of this other secondary stuff that was going on. Apologize for the phone. And it occurred to me that I would probably never fully recover from the accident, for one. And for two, I don't know if there will ever be a time where all of the issues that I still experience today would ever be addressed. And here it is, almost, 4 years later now, I think? 3 or 4 years later? I don't know. Time blindness is a thing. But here it is, multiple years later, and I still have yet to hear back from the doctor about everything that's going on, right? So this fast forward up until a few months ago. And the reason I bring all of this up is because I started doing research and started sort of looking into the why behind certain things are done. Like, for example, somewhere over the last few years, the insurance changed. So instead of a doctor being able to look at us as a whole person, they can only look at us one problem at a time. Now, I can't take sick time for a day, a week, for the next 7 weeks to get all of this done, right? It just doesn't work that way. And with the VA, the amount of care I have received at that precise moment in time, plus my 2 failed hernia surgeries, there's a lot of history with the VA that made me reluctant to go back to the VA. Also, around that time, I was trying to see a primary care at the VA. This was the years ago, around the time when I had that rollover accident. And for whatever reason, I could not find a single appointment at a VA facility. And again, I'm combating a TBI. I'm not able to function all the way. No one's there to support me. I'm kind of on my own, and I can't find help anywhere. So I give up. I start the road to recovery without medical help, right? I start walking more. I start sort of doing things like I try everything in my power to mitigate the pain and the discomfort. I know I need hernia surgery, but I cannot seem to find a doctor that says that it's bad enough to necessitate surgery, right? Come to find out, I had 3 hernias at the same time, but because no doctor would actually listen to me for a period of almost 2 years, I was having to go through this extreme amount of pain in my abdomen. And I'm thinking it's something else down there, but turns out it's 2 freaking hernias. And so all of this time, I'm incurring all of this other medical issues because I'm not getting anything fixed. And the more I progress, the more things are getting worse. And then finally, after several years, they were like, okay, let's schedule you a hernia repair surgery, right? So all of this to say that for a period of several years, I was not getting the help that I needed, right? There's no preemptive or proactive medical care. I can't get a team of doctors to sort of tell me what's going on. I can't even get a response from the VA. All of this at the same time, trying to recover from this TBI, being on my own for the first time in 20 years, autistic burnout, being stuck in a job that I absolutely couldn't stand, all of these things happening at the same time. So fast forward to a couple of months ago, right? Now it's more than a couple of months. This would have been last November. I go to the doctor last November complaining about a particular issue, and then I'm not going to get into all the particulars of it. However, it's wildly uncomfortable. And it's something internally going on inside of my stomach area. They can't figure it out. So I keep getting these appointments. They keep telling me to go to urgent care. They say it might be this. They say it might be this, but I can't get an appointment for like 3 months at a time. I can only cover one problem at one appointment. And so I have to decide which of my 10 problems I want to work out at this particular time, because the insurance companies, I don't know if you know this, if your doctor bills too many problems at a doctor's visit, they get in trouble with the insurance company. It's all the same thing with billing too, right? Your doctor would love to just forgive a $20 bill and move on, especially for some of their patients who are, as they see, the most financially in need. However, the insurance company will remove you from their insurance if you don't force that person to pay that bill. So you have this competing resources of doctors wanting to help patients, insurance companies saying you can't help patients, doctors wanting to help patients financially to help offset some of the medical costs, and the insurance company says, well, if you do that, we're not going to pay you any money. The system is kind of jacked up right now. And I have one of the best employer-sponsored health insurance that is out there. So if this is happening to what they say is the best or Cadillac of employer plans, what's happening to people below me? What's happening to people that are on those medical advantage programs, right? Are they going 6 years without a hernia operation? Are they being told they can't get a single or certain kind of test that would rule out cancer? And then the time it takes to do all of that, and you're looking at 3-6 months down the line that they have postponed by denial and denial and denial. And then finally, when they say yes, well, now you have cancer, and the cancer has progressed 6 months of time, right? So they could have done something different. They could have spent a lot less, but they don't want that, do they? No, they want you to prolong it out. They want you to get worse, because if you get worse, it costs more to treat you. And if it costs more to treat you, they make more money. And then they go around and they say, well, you as an employer, you have too many of your employees who are costing this much. So we're going to raise your rates, right? So now employers have a vested interest in laying off or terminating people that are causing the high cost in premiums. So people with disabilities are getting harmed. People with disabilities are getting harmed in ways that you can't even possibly imagine, right? So not only are we being told we don't have accommodations, we're not going to accommodate your disability, we're also being told, hey, if you go to the doctor for your disability, it's likely you're going to get laid off or fired. Now, luckily, I'm in a position where I don't have to worry about that, right? Do I? Every single day. So here I am, several months, trying to figure out what's going on. Every time I go to the doctor, they do one examination, one problem, and they rule that out and then schedule an appointment at 3 months, right? All the time that I'm dealing with all of this stuff, I'm not able to leave the house as much. I'm not able to enjoy my friends' shows or concerts as much. I'm not able to do a lot of the things that I would normally do because inside there's something wrong. So I get fed up and I'm like, you know what? I'm going to try the VA one last time because, like, I'm obviously not getting anywhere with my new primary care and my new insurance, right? I'm not getting anywhere. So let's go to the VA. Let's throw our hands up because something's got to give. So I go to the VA and things are a little different this time. Now, I don't know why they're different. I don't know what changed. But the 3 things that have happened in the last couple of months that have blown my mind. 1, it was only taking me a couple of weeks to schedule an appointment with my doctor. I'm able to schedule follow-ups and have constant communication outside of those appointments, right? So we can email each other back and forth. New symptom popped up, pop this to the chart. New symptom popped up, pop this to the chart. Where if you do that in the insurance sector, I'm sorry, I would, but we need to schedule an appointment for you 3 months from now, and then you can tell me your new symptoms. Well, how much is my symptoms going to progress between now and the 7 to 12 to 14 to 24 months from now when I finally have enough appointments to get it all done? So back to the VA, right? Imagine my surprise when I sit down and my doctor comes up and he's like, oh, I reviewed everything in your chart for the last couple of years. I can't remember a time a doctor has said that to me. Oh, I reviewed everything in your chart. What? So not only have I reviewed everything in your chart, let's go through everything that's going on. And we spent 30 minutes together talking about everything, right? Like a holistic health approach. Fast forward a couple of weeks later, an event happens. I'm going to the emergency room, right? But this time, instead of going to the emergency room in the private sector at the best hospital out there, I go to the VA emergency room. Imagine my surprise when I'm at the VA emergency room and they start doing tests on everything it could be and ruling out things, but also looking at other things at the same time. They're not looking at me like a number to get out of the bed, the triage area, to get out of the bed in the back. No, I was there for quite some time, and they ruled out a lot of things. And imagine my surprise when I come home the next day later, and there are multiple tests out there. There's a request for me to see 2 other specialists. I've been dying to see one of these specialists for 3.5 years. So the fact that I'm actually able to see a specialist I've been asking to see for 3.5 years using my employer-based or employer-sponsored insurance, well, that's something. So to this day, we still don't know. It's a journey that is not yet complete. But it is to the point where I felt like I had to come on here and say something, because what's happening to me is happening to thousands and thousands and thousands of people. We are no longer in charge of our own health care. It used to be that a doctor and you had a conversation and decided the treatment plan. Now it's an insurance person who is likely not even a professional in the same area that is determining whether or not the plan that you and your doctor create together is acceptable to their profit margin or not. It's to the point where private health insurance no longer sees us as people, and they see us as numbers. And if you don't think that's true, ask about it. Ask your doctor about what happens if they spend 45 minutes with the patient. Ask them about the phone call they get from the insurance company asking them why they took so long with one patient. I don't know if you'll get the right answer, but ask your doctor about why they have to charge patients who are financially unable to pay their bills and have them pay at least even $10 a month, even if they can't afford it. Otherwise, the insurance company is going to do something drastic and they're going to lose their ability to practice medicine. This happens in the real day-to-day, folks. How many people out there that I know of, just here in this little city of Salem, that have had to go months and months before a diagnosis of cancer, and now the cancer's in stage 4. Now, if they were listened to and the insurance actually cared and was proactive, we could have gotten it at month 2 instead of month 9, or month 3 instead of month 24. And how many people have died because of a denial of procedures? We're talking about people's lives here. Not just financially, right? Because that's a huge component. We're also talking about people who have needed treatment, who are now living lives in agony every single day because of an institution and a system that weighs heavily against people with disabilities. You know how many people I know that are deaf that get chastised for not hearing their name being called in the waiting room? Yeah. Do you know how many people who are deaf who can't find an interpreter And when they can't find an interpreter, instead of being proactive and trying their best to find a solution to help this person out, they're left on the sidelines, not understanding what's going on because nobody is willing to talk to them. There's actually a very interesting scene in the show, The Pit. And this show in The Pit that has this woman who is deaf, whose care was prolonged for hours and hours and hours because they didn't have reasonable accommodations. And you know what happens when people's rights are being violated in this country, especially in terms of the ADA? Nothing. You know, I lodged a complaint when Providence told me we don't do accommodations here. And the federal government says, I'm sorry, we don't investigate stuff like that. The Department of Justice, under the ADA, who's supposed to do an investigation, oh, we don't investigate. Really? What's going on there? Oh, we don't have enough people investigating. And under the recent administration, the number of investigators who investigate violations of the ADA has been reduced so much that they're basically ineffective at this moment in time. So people's rights are being violated. People are dying because of financial decisions. People's lives are made extremely difficult for an extreme amount of time because the insurance company will not allow doctors to treat a person wholly. They repeatedly deny blood work for people over the age of 40 in terms of preventative health care. Good luck if you want monoclonal antibodies. Good luck if you want to test your testosterone levels, or if you want to test your estrogen levels, or if you want to test your hormones. You want to test for vitamin deficiencies. They don't do that. No. If you want to do that, you got to go somewhere else and pay $5,000. So there's a test that costs a couple of dollars that will let you know what your vitamin deficiencies are, what your hormone levels are, all of these things. And then your doctor and you could plan a plan of attack that's individualized that will get you to the optimal health that you possibly can. But yet that is not something the insurance companies allow doctors to do. Let that sink in for a minute. We are not allowed to see how healthy we are. And we're not allowed to seek treatment until we are the worst of the worst. And every time you delay care for whatever reason, it's harder and harder to heal what's ever going on. So now it's been 6 months for me. Still no answers. Still don't know exactly what's going on. And I do have a legit concern that the longer this goes on and the more it's delayed, the more irreversible the damage. And I know I'm on borrowed time as it is. As somebody that's my weight, who's almost 50, I understand that. And I'm trying. At the same time, though, like, I'm trying blind. Right? Like, I'm trying to diet, I'm trying to do all these things, and I'm trying this, and I'm trying that, and nothing seems to work because nobody seems to care. Nobody seems to know the right thing for nutrition. Nobody seems to know the right thing for weight loss, right? I'm definitely not going to go with Ozempic. My history and of reactions to medications, I can't do it. I would love to. So I guess in a nutshell, I'm saying that this is my journey. This is my story. And it's not an isolated incident, right? So many people don't have access to the VA. So many people don't have access to a doctor that has the ability and the time and the funding to treat you like an entire person. And if anybody thinks that this is just an isolated thing, let me tell you about the hypocrisy of the my brain sucks after that. The hypocrisy of your annual physical. The way the insurance is structured, the physical, is that if you go to a physical, it's covered at 100%, right? Tell me if you haven't been through this too, individually, right? But if you go to the physical and you report any medical condition, well, now it's going to be charged to your deductible. So what are you going to do? Are you going to come out with $200, or are you going to sit there and be quiet and pretend there's nothing wrong? Oh, yeah. And by the way, now that you've had your physical and you've said that there's nothing wrong, it's really hard to say that there is something wrong a month later. Oh, what happened? You said nothing wrong a month. Then that dictates how the insurance can respond. So two things are happening in the background. One, the insurance company is profiting on the fact that they want you to say nothing is going on with you at the physical. Because if you don't, well, now you're financially punished for $250. A lot of people will say they're not sick for $250. A lot of people. And then if you don't say you're sick, and something happens and you knew about it 2 months ago, but now your new problem, now your insurance company has the ability to go back and actually deny your claim, because they're saying, well, it can't be that because you had no symptoms a month ago at your physical. What, were you lying? So the ramifications of delaying is significant medical costs. They have so many things built in place to deny and delay your care that they want you to be later online. They want it to cost more on the back end, right? They don't make money on preventative care. And because it's all money driven, they don't care about preventative care. So that's my medical rant. Maybe next time I come on air, I might have some results for you because, yeah, it is what it is. So I'm here with you, frustrated, concerned, not knowing what to do because ultimately I don't know if anything can change. And until something changes, more and more people are going to die. And even though people are dying, no one's ever held accountable. No one's ever paid reparations for when things went wrong. So I hope I'm here in 6 months. Truth be told, I don't know. Nobody has answers. So until I find out, I'll keep plugging away. And I'll keep apologizing for missed events like Timmer's birthday. God, I wanted to go. But my body said no. Love you, Timmer. You're the best. And here's to the healing curve. Let's see what happens next. Be kind, y'all. I'll end the podcast the way I always end the podcast. We all live on the same planet. We breathe the same air, and this world would just be a little bit better of a place if we all treated everybody with a little bit of dignity and respect.